Hi, so I'm Helene. I'm one of the founders and the CEO of RAMPMedical. Did you know that in 11% of the cases that you go to see a doctor, you're not getting the right treatment? We've been testing this with diabetology experts, and we found that in 29% of the cases, these specialists chose a therapy that the European Medical Agency labels as dangerous, meaning that this could potentially kill the patient. It's not that we don't have amazing doctors, quite the contrary. The challenge is that there is so much research coming out. In diabetology only, it's over 40,000 new research papers being published every single year. Simply impossible for any doctor to stay updated with all of this. This is where RAMP comes into the picture. We provide a simple software solution that needs the diagnosis and the relevant patient data, and then excludes in a first step everything that would be dangerous for the patient. The remaining therapies are afterwards shown in an easily comparable way and ranked so that the doctor can identify the optimal treatment on the spot. We tested where doctors used RAMP as support, and here they found the optimal treatment almost every time. Our business model is simple. We charge hospitals in our short and mid-term strategy as they can work so much more efficiently and save a lot of costs. And our long-term strategy, most important point, we have already 3 hospitals engaged to integrate our solution into their medical health record. And our long-term strategy, as I wanted to say, is to achieve a reimbursement from health insurances. This is our team. I've been working in the industry for a long time. Jacques is an in silico drug designer. Tobias was the CTO at Gesundheitscloud, and Alejandra the service designer at Startup Bootcamp. Here are some of the great advisors and partners that helped us get where we are now. And you can see that 50,000 euros would help us to get much further, to achieve a medical device authorization, go forward with our cardiology version, and then be more mature for next funding round. So we are happy about every support that we can get and everybody who joins us on this journey. Thank you.
Thank you very much. Great presentation. I would like to ask you how to feed your system with up-to-date information. So there's lots of movement, lots of science.
Yes.
Not only in diabetes. And what's your approach to feed your system with informed and validated information?
Yeah, that was one of the 2 biggest challenges that we had. And it's actually, so what we use is basically, so mostly authorizational studies. So clinical trials, we use guidelines, and we use the product characteristics. That's the sources with the highest evidence. And for the guidelines, well, you know how often guidelines come across. That's not so often. This we do manually to be absolute accurate. That's important then. And for the studies, we have scripts, and we have very specialized scripts to be very accurate. That's very important for us. Yeah.
I think it's a great way towards outcome-based medicine with a fantastic decision support system you're offering. Just the question whether you are considering to collaborate or partner with the professional societies, let's say professional societies of diabetology, so cardiologists, and on your way to offer them your decision support system.
Yes,
as another business model.
Yes, yes, in Germany this is particularly important. That's why we are just in Switzerland actually with 2 hospitals and 1 hospital in France. And in Germany it's very important, though it's not such a difficult business model, as these are still doctors who then somehow are involved in a hospital or in a practice. So that's still the same thing, then the same advantage as this short-term level now. Yeah.
My question would be first, what about competition and how do you set yourself apart? Because in my knowledge there are other competitors in the market that also tackle same problems.
Well, you know, the pioneer is IBM Watson with cancer, and they almost 7 years ago now they started this project. 8 years ago they started the project, and they came across, well, what they did was they tried to find how far do you get with NLP on this, and then they had a very big accuracy issue, and that's was good for us then to see, okay, where are the challenges there and how we can change this, what has to be done still by hand with other techniques. So what we do now, we really use hybrid techniques to get to our values, and in the end this means a much higher accuracy of the outcome. And also what was found then, well, when this first didn't work as well, was that you cannot just predict one therapy now to recommend. This was something that didn't work out, and so this what we could learn from, and this what we improved, basically to calculate a much more diverse, you know, what, and just show to the doctor, inform him well enough so he takes the decision on his own in the end. And this is what others didn't do before. Yes.
And do you aim to tackle like a lot of indications, or do you aim for certain indications at first, or fields of indication?
So we started with diabetology, and now we're working on cardiology, and also pain medicine is halfway in the system already, but it's kind of accompanying other medical fields. And we would like to add all medical fields one by one to help more people.
I have another question. Thinking about very complex health states, let's say a patient with diabetes who has also cancer is on chemotherapy. These are situations which are not covered by guidelines and also not by randomized controlled clinical trials. So how your system would react in such a case?
So in the one part of our software that just excludes dangerous therapies, this is the point that is so difficult to find the right therapy. What is going on with the comorbidities? And this is what we include. We find there are publications on that. So we see what is contraindicated. That's in all our sources. Basically we find somewhere where are the real contraindications, because often there are no studies on that, and this is where we can, thanks to our very well structured data that we have been making with our scripts, we can also predict then when there's really no source on it, we can predict based on the molecule structure where there would be some danger potential. Yeah.